Hello, and welcome to our webinar, Partnerships That Work, TBI State Service and Protection and Advocacy Programs, offered by the National Association of State Head Injury Administrators. State TBI programs and P&As can learn a lot from each other and work together to maximize efforts in advocacy and service provision for individuals with brain injury and their families. Join us for this informative webinar as we discuss one state's innovative approach to making this program partnership work. Learn about state TBI programs and PATBI initiatives from NASHIA and NDRN. Listen as ideas are discussed for collaborative projects between lead TBI agencies and state P&A programs. I'm Carrie Bennett, Chair of NASHIA's Training and Education Committee. Thank you for joining us today. If you're unfamiliar with NASHIA, we are a nonprofit organization created to assist state and territorial government in promoting partnerships and building systems to meet the needs of individuals with brain injury and their families. A GoToWebinar user guide is available for download from the NASHIA website. This is a great resource for making the most of your live webinar experiences. Handouts of today's presentations are available for download. Please check your attendee control panel for the handouts pane. To ask a question during the webinar, please enter it in the questions pane and our organizer will forward your question to our speaker after the presentation if time allows. If we run out of time, we'll respond to your question via email. All of NASHIA's webinars are recorded and archived at the NASHIA website. A transcript of this webinar will be available upon request, as well as the archived recording. And now I'm pleased to introduce our speakers. Rebecca Wolfkiel joined NASHIA as Executive Director in January 2018. She brings over a decade of experience in promoting federal policies that provide resources for individuals with brain injury and their families. She's committed to representing the interests of state governments and supporting the unique and integral role they play within the service delivery system. In her 8 years with the Ridge Policy Group, representing NASHIA as a government affairs advisor, she played an integral role in the successful reauthorization of the Traumatic Brain Injury Act in 2014, paving the way for the federal TBI program's move to the Administration for Community Living. David Boyer is a staff attorney at the National Disability Rights Network, where he provides technical assistance and training on a variety of topics to include prison litigation, abuse and neglect, traumatic brain injuries, and monitoring. Dave was previously the Director of Investigations at Disability Rights Florida for almost 10 years and has served in the United States Army for almost 30 years, where he twice deployed to Iraq as a psychologist for the 101st Airborne Division. Christy Johnson is an investigator supervisor with the Alabama Disabilities Advocacy Program, or ADAP. Christy joined ADAP in 1994. She coordinates and supervises ADAP's investigation and monitoring activities and ensures its compliance with ADAP practice standards. She provides case advocacy services to adults and children with disabilities and manages ADAP's traumatic brain injury grant work. Christy brought to ADAP a broad range of experience, including coordinating a rehabilitation program for homeless adults with mental illness, working as a service provider to children with emotional disturbance, and directing a social services ministry appointed by the Baptist Home Missions Board. She received her Bachelor of Science degree in education from the University of Alabama. Finally, Maria Crowley has worked for the Alabama Department of Rehabilitation Services for 29 years, currently serving as the State Head Injury Program Director. Maria coordinates state TBI programs and services, the State Head Injury Task Force, Head and Spinal Cord Injury Trust Fund Advisory Board, and the Alabama Head and Spinal Cord Injury Registry Service Linkage System. She is also past president and current board member of the National Association of State Head Injury Administrators Board of Directors. She collaborates with many of Alabama's partners in brain injury, including the Alabama Head Injury Foundation, UAB TBI Model Systems, UAB Children's of Alabama, the Alabama Department of Public Health, Alabama's Disability Advocacy Program, and the Children's Concussion Clinic Task Force. Today, our objectives are to learn of national level work with states that are led by NASHIA, understand the current national level work between NASHIA and NDRN, and hear an overview of NDRN and about the PATBI programs. You'll also learn about the importance of collaboration between state TBI service systems and protection and advocacy programs, understand the collaboration as it exists in Alabama, and identify points to consider when developing a partnership. And now I will hand over rights to Rebecca Wolfkiel. And welcome, Becky.
Thank you, Carrie. Hello. Can you see my screen okay?
Yes.
Okay, wonderful. Well, thank you, everyone, for joining us today. And thank you to Christy and NDRN for co-hosting this webinar with NASHIA. NASHIA is the only association that represents state employees who work in the TBI field and administer and work in TBI programs across the country. While we have members in every state, our members are housed in various offices and agencies across the nation. So while some of our members administer their brain injury programs from their Department of Human Services, others administer their program through the Vocational Rehabilitation Office. So we have a very diverse group of members, all committed to serving individuals with TBI and their families through state systems. NASHIA at the federal level here in DC, we advocate for resources that will help our states provide partnerships and systems to assist individuals with TBI and their families. We do that by advocating for increased funding for federal programs at the Department of Health, like our TBI State Partnership Program that's run through the Administration for Community Living. We also advocate for additional funding for the P&A program, the PATBI program, also run out of ACL. This year, we worked very successful along with our partners in getting some additional resources for those programs, and we've been excited to see the benefits of those additional resources trickle down to the states. We advocate for the CDC TBI program and have been advocating for them to their expansion of the concussion surveillance database that they've created. Also helped disseminate their report to Congress on pediatric TBI and have been instrumental in helping CDC to put some definitions around mild TBI guidelines. In addition to advocating for additional resources, we also advocate in DC for TBI to be part of the conversation in discussions, broader discussions around person-centered planning systems, LTSS systems, and other care systems that should also consider the special and unique needs of individuals with TBI. We work to raise awareness nationally. We have an awareness day in March on Capitol Hill every year. We celebrate March as our TBI Awareness Month, and just last year started a 2-year national awareness campaign, Uniting for Brain Injury. We use our e-news and our social media sites to push out information related to brain injury that we believe would be beneficial for not only our members, but anyone in the nation that is interested in learning more about individuals with brain injury. We provide training and technical assistance like the webinar today. We try to host several webinars throughout the year. Oftentimes we offer CEUs for those webinars, and we do provide one-on-one technical assistance and consultative services to states and community-based organizations as well. The Traumatic Brain Injury Act is the only piece of federal legislation that provides direct funding for the civilian population living with brain injury. I mentioned the different programs, I think, earlier that the TBI Act funds, but again, it's the state grant program through the ACL, it's the P&A program through the ACL, the CDC TBI program, and some research for TBI at NIH. NASHIA was instrumental in having this law created in 1996, and in its very first reauthorization in 2000, we partnered with NDRN to create the Protection and Advocacy for Individuals with TBI program, as that was not in the initial 1996 law. Since 2000, NASHIA and NDRN have partnered together to, at the federal level, to ask for additional resources for these programs and to ensure that our federal regulators understand the unique population that we are serving. NASHIA and NDRN have enjoyed strong partnerships here in DC and at the national level. As I mentioned, we do partner together on legislative advocacy. We also partner together on awareness activities like this webinar today. NDRN has consistently participated in NASHIA's annual State of the States and Head Injury Conference. We also sponsor our March Awareness Day on Capitol Hill together each year as well. So while we've really enjoyed a strong relationship at the national level, we know that some states like Alabama that you'll hear from today have had some very strong successes partnering at the state level, but other states could learn from Alabama on what the benefits are to partnering and really how to do so. I think folks understand that partnerships are good, but especially within our community in the TBI world, as I mentioned earlier, our programs are not housed in one specific office and one specific agency in every state. So sometimes our members can be hard to find. And so we're hopeful that today folks on the webinar will learn about ways to find one another and create some partnerships and create some good opportunities and momentum moving forward within the states. So with that, David, I'm so thankful that you and NDRN have partnered with us today on this webinar, and I'll kick it over to you for your presentation.
Great, thank you. Can you see my screen?
Yes, it's not on the full screen, but it is up there.
Yeah. Is that good?
Yes, we can.
Excellent, thank you.
Okay, awesome, thanks. Okay, well, thank you, Rebecca. That was a great introduction. I'm Dave Boyer. I work for the National Disability Rights Network. I'm a staff attorney. NDRN is the nonprofit membership organization for what is known as the Protection and Advocacy System. So what I'm going to do for the next couple of minutes is kind of explain what the P&A system consists of. It's kind of an unusual beast. So it's congressionally mandated, legally based, and provides disability services through all of the states. Each state and each territory has an individual P&A, so there's one in each state, one in each territory, and each of those has authority to provide legal representation and advocacy services, both, to people with disabilities. And the federal government has granted them special authority to do so. Originally, the P&A was triggered by a series of local news stories of all persons, Geraldo Rivera. So he's in our history. He did a series of news stories in New York City on a facility called Willowbrook, which was a state institution for people with developmental disabilities primarily. That reporting exposed abuse, neglect, serious lack of services at Willowbrook, and kind of the outrage in Congress led to the very first P&A program, known as the Protection Advocacy for Individuals with Developmental Disabilities. Long name, we call it PAD, P-A-D-D. And that's the first one on your screen. What happens is the governor of each state is required to designate an agency to be the P&A and to ensure that the P&A is independent of any other state providers. Most of the P&As are private nonprofits, but a few still remain under the state governments. We have one that's in a state university, housed in a state university. That P&A might be represented on this call. And then a few P&As are in civil legal services programs, but primarily P&As are under nonprofit organizations. And each of the P&A programs after the Protection Advocacy for Persons with Developmental Disabilities, each one of those was required to be housed under the same agency as PAD. So you can see the list here kind of covers the gamut of disability issues. We have the first one, developmental disabilities, and mental illness. Individual rights is a grant that covers legal representation for people who aren't covered by PAD or PAMI, the mental illness grant. So this covers a lot of people that are blind, deaf, other physical disabilities. And then we have Protection Advocacy for Traumatic Brain Injury, or PATBI, the grant that we're talking about today. So you can see that it's just another one of the grants under our kind of rubric of protections. The Protection Advocacy for Assistive Technology for beneficiaries of Social Security, which covers the Ticket to Work program, voting accessibility, the Client Assistance Program, and then we have a new grant that was just enacted this year that covers the Social Security Representative Pay Program. So we monitor folks that are under that program and make sure that all the proper procedures are undertaken. So that's our newest grant. Each grant has different authorities. Obviously, it's different groups that are represented under each grant, but each, in general, gives the P&A the authority to, and typically they quote, pursue legal, administrative, and other appropriate remedies on behalf of people with disabilities. So basically, there's a wide range of services that a P&A can engage in to help people with disabilities. That can be just assistance with self-advocacy. It could be litigation, class action lawsuits. It could be public policy work. By and large, what P&As do is provide individual representation and advocacy help with very discrete issues. But a lot of times the issues can be wide ranged and result in class action lawsuits or extensive public policy work. So P&As have a long history working against abuse and neglect as the initial trigger, the abuse and neglect at Willowbrook. We've continued that work. We have special authority to investigate facilities for abuse and neglect. We have special access authority to look at records, to meet with clients in those facilities, and conduct investigations. So I'm going to go on specifically now to kind of PATBI by the numbers. So if you can see in the last year, 7,243 cases were information referrals. So that's basically someone calls a P&A with a question, and maybe we aren't able to provide that service, but we know somebody that can, so we can provide referrals or information pertaining to that question. So 7,243 of those calls were taken last year across all the states. 1,358 training activities, so these were seminars or workshops where 44,000 people attended, and 225,000 materials disseminated. Individual cases, so these are cases that we take and we have the resources and we have the authority to take on that case. 1,006 cases were accepted last year. 138 policies were changed either at a state level or at an individual facility, getting policies changed. Lawsuits, 18 non-class, 6 class action lawsuits. So you can see that of those 1,006 cases, and I'm going to break that down in a minute, but very few are actually litigation focused. Primarily, it's working with an individual client to provide some assistance. Here's some of the problem areas that we've covered, and you can see as our history of the P&A system, we do a lot of work in institutions, so a lot of healthcare work, 25% of our cases, a lot of abuse and neglect, 15% neglect, 7% abuse, and really housing has become a recent issue. A lot of folks need housing in order to get other services. If you don't have housing, then you can't take advantage of some of the other programs. So housing has become a very big focus recently. Here's kind of the interventions again. Like I said, primarily short-term assistance, 70%. So this is just a person calling in, requesting assistance, assigned an advocate, and that advocate goes and assists them either with self-advocacy help or works with the facility they're at or works with an organization in the government to obtain some services. So primarily 70% is that kind of advocacy. You can see 3% is just litigation, 5% administrative hearings, typically for benefits related issues. And this slide just kind of tells what were the outcomes of those cases. And you can see a big chunk of this, 48% were all issues resolved and 23% were some issues resolved. So about 71% either got complete resolution of their problem or at least most of their problems solved. Only about 4% were not resolved at all in the client's favor. So we're very, very excited about those outcomes. And in general, the P&As have been doing great work with the PATBI program. So at this point, I'm going to turn it over now to Christy, who works in the Alabama P&A. They've had some great success, and her work shows how P&A can do good things and work with other organizations. So, Christy.
Great.
Okay, thank you. And Maria, did you want to actually begin?
Yes. Can you see our slides?
Yes.
Yes,
Good.
your slides are up.
Okay, thank you. Hello, greetings from Alabama to those of you who are joining us. Christy and I want to just take a few minutes to share with you a little bit about how the partnerships work here and why our partnership works here, and give you some examples of how you can maximize the partnerships in your own states. And we thought first we'd start with some basics about how each of the programs operate on a state level for those of you who may not be familiar with one side or the other.
Okay. So I'll start out, and I want to begin by sharing just some information about some of the basic functions or services provided by P&As, and I know Dave mentioned a few of these already, but P&As do employ attorneys and advocates who provide legally based services to individuals with disabilities in order to protect, promote, and expand their rights. Obviously, those functions look different depending on the activity that the P&A is engaged in. So we do provide a lot of information and referrals to individuals who call in, or in our agency. We all have websites where folks are also able to write in and request information as well. We do provide a large number of our services is dedicated to providing individual advocacy services to support and empower individuals in attaining independence and equality and accessibility. So an example, a concrete example might mean one of our advocates or an attorney attending an IEP meeting in a school setting to work with the guardian of a student who maybe is in need of supports. We've worked with a number of families and children who have been diagnosed with a TBI and maybe had not yet been identified in the school setting. We provide a lot of education and training to consumers, family members, and professional groups on a broad range of disability rights issues all throughout the state. And folks can call into our agency to request those trainings, or they can also use our website to request a specific training. One thing that makes us unique that David mentioned is the P&A enabling statutes provide significant authority that allows us to conduct investigations of a possible abuse and neglect upon either receiving a report or a complaint, or when the P&A itself has probable cause to suspect abuse or neglect. So an individual might call our agency to report an allegation on behalf of themselves. They may call for another individual. It's not uncommon for us to receive calls from persons that want to remain anonymous. We also can read about or access information in the public sector, in the news, for example, of allegations that might involve an individual with a disability, and that triggers our access authority to initiate an investigation. And we'll talk a little bit in a few minutes about how these functions can really help foster those collaborative relationships with our state head injury partners. A vital function of the P&A is the ability to monitor in facilities where we are looking basically for rights violations and safety violations in those settings, and also to inform individuals with disabilities about their rights. And we provide just basic information about the P&A system. So we don't only go into programs where they are serving entirely people with disabilities. It's not uncommon. We've been in jails and prisons and in our Department of Youth Services where youth are adjudicated delinquent. Obviously, those programs serve people with various disabilities, but they also serve people without disabilities. So something that's unique to the P&A, a function, is that as we go in and monitor, we provide information about the P&A to all people that are being served in those particular programs. And then as individuals contact us with concerns or questions, the P&A is the final arbiter that decides whether or not that person has a disability, and if that disability meets the criteria for us to serve them in a specific capacity. And then finally, David mentioned that we do have the ability to litigate, and our authority allows us to provide legal representation to both individuals and to classes of individuals. So to give you just a couple of concrete examples of some of the litigation that we're working on in Alabama, our Department of Corrections, our prison litigation addresses the provision of mental health services, medical services, and physical accessibility and service delivery accessibility to individuals with disabilities. That is a population where we obviously have a number of individuals who have experienced traumatic brain injury. We also are engaged in litigation. It's our EPSCT litigation, which is early and periodic screening, detection, and treatment, which is the child health component of Medicaid, which requires states to serve children under the age of 21 who are enrolled in Medicaid. It basically just means that those kids are entitled to all health benefits under that particular Medicaid option. In our state, we don't have waiver services or any dedicated services for kids who have autism. And so the primary focus of that particular litigation is the creation of services and supports for individuals with autism under the age of 21, and also for kids who have been diagnosed with SED, or a serious emotional disturbance. And then finally, our Hunter litigation involves the Alabama Department of Mental Health and inmates who are housed in our county jails who are either awaiting transfer to our state-operated forensic mental health facility, either for evaluation, maybe they've been ordered there for restoration or for treatment. We have a backlog in our system. I think that this is probably common throughout the country, where we have run out of beds in that forensic facility, and our folks, as they're being moved down to less restrictive settings, there's kind of a backlog has been created, and we're really not moving those folks out into the community as we should be. There's just not enough placements available, and so that's an area of work where we're primarily focused as well. And Maria, I'll let you speak to your basic functions.
Okay. So a lot of what goes on with the state TBI service programs mirrors much of what Becky described for NASHIA. It just happens within the states. One thing that Becky also mentioned to you is every state has a lead agency that differs in every state. So as you can imagine, TBI services and service delivery also looks different in every state. The state programs are responsible for establishing and maintaining the types of services related to brain injury that get delivered to individuals and families. The state program establishes priorities for services and initiatives, and then every state seeks state or federal funds to pay for those services. Again, there's every state looks very different related to where their funding comes from. Some is trust fund money. Some is appropriated by state line item funding. Some states have TBI waivers, but all don't. There are blended funds across programs. We're able to use some Title V funds to serve, here in our state, children. Our pediatric program is paid for with Title V funds. Vocational rehabilitation provides funds for brain injury, and so on. Here in Alabama, the lead agency was designated some time ago under the Department of Rehabilitation Services. So, as you can imagine, we have paid a lot of attention in terms of priorities to employment and employment-related services. And then over time, we have expanded the program that we have here to include a much larger infrastructure. Many states have a state plan. They have an advisory board. Ours is the Alabama Head Injury Task Force that oversees, that provides some programmatic oversight for what's going on related to traumatic brain injury in a state. That group here meets quarterly. The Protection and Advocacy Program holds a seat for that advisory board, just like mental health or public health or the traumatic brain injury model systems or injury prevention or any of the other members of that advisory board. And as such, they are able to and willing to participate in some of the working committees that are a part of that advisory board. Christy mentioned concussion. There's a sports concussion committee that's a part of our advisory board, and a return to think committee that's a part of our advisory board that she's been keenly interested in participating on. We provide training and education statewide through that advisory board and through our TBI service staff to a variety of service providers and consumers and families statewide. We provide information and referral in general through our department, and also as a piece of our state trauma registry and service linkage system. Some states hold those services in-house. Other states contract for some of those services with other providers. such as their State TBI advocacy organization. For Alabama, that's the Alabama Head Injury Foundation. That's another strong key partner within a state that if you've not connected with them, you need to. And then last but not least, our funding for the TBI grants comes through ACL. That funding allows states to build on their current infrastructure and address special populations or special projects like we have done with the last grant funding we received with juvenile justice. Some states focus more on pediatric issues, others focus on adult issues. It really just depends, again, on where that lead agency sits. And if you need to know who your contact person is in your state, you'll see a map on the slide that has the NASHIA web address, and you can click on your state and find out who that is. So, Christy?
Okay. So, obviously, as we're talking about why we work together, there's strength in numbers. All P&As, have to consider our resources that are available to achieve our goal of serving people with brain injury. Our brain injury grant is our least funded grant, and so we do have to be creative about looking at how we are going to allocate those funds and where we're going to focus our work for the upcoming year. Just so you know, this is the time of year where all P&As are looking at their annual priorities and goals, and which is required by our federal partners that we develop those priorities and goals, which kind of narrows the scope and helps us to, as we're working out the next our work during the next fiscal year. It certainly doesn't mean that we can't take on projects or activities outside of those goals, but because of our limited resources, both physically and financially, we certainly have to take that into consideration. So if you've not done so, I would encourage you to talk with your P&A about how they're spending that money and what they're doing with their time as it relates to working with individuals with brain injury, and what you feel like are those critical issues that you're seeing in the population that you serve. I don't know, Maria, if you had any comment about that or not.
No, that sounds good. There's just, in every program, there's not enough of us to go around. It just makes sense to combine our efforts across programs.
So it kind of leads into this good cop, bad cop relationship that we often kind of find ourselves in. And I'm just going to give you an example of how communicating our concerns and simultaneously working towards those same concerns and those goals, we really can make progress in that way. So in Alabama, both the State TBI program, Maria's group, through its advocacy efforts, and ADAP through our investigation and monitoring efforts, we have been working with the Alabama Department of Mental Health to promote the development of a TBI screening protocol within their system. I think we probably have talked with other folks around the country, and I believe that this is probably an issue in other states as well. So during the course of our investigation and monitorings, we've identified a number of individuals served in our mental health facility. We have one licensed facility left in our state that's operated by our Department of Mental Health. And through our involvement in that facility, we've discovered there's a number of individuals who have suffered traumatic brain injury either during their stay at the facility, or they had a significant history of exposure to head and neck injury before they came into the system. And so through conversations that Maria and I have had and others, we realized that we really needed to begin approaching that system to begin discussions about them including a specific tool and a specific process and protocol to identify people, not to weed people out of that system, but we all know it's critical to look at the whole person. And if we're not considering the possibility that a person may have had exposure to head and neck injury, it could be impacting the success of their treatment. So ADAP has been meeting with the department through our investigation arm, bringing to their attention cases that we have identified, and we're pushing for them to adopt a screening protocol. And then Maria's group has been talking with them separately, really to achieve the same goal. And Maria, I don't know if you want to talk a little bit about that.
We have embarked down a partnership path with mental health and have approached it from the training and education perspective, because as Christy mentioned, that brain injury is within that population. They need to know about it for the best intervention and treatment of the consumers that they're serving. So it makes sense for us to work together, and the protection and advocacy programs can do what I, within a state system, cannot do. So, I'd encourage you guys to use that to your advantage when you're working with some of the other state agencies in your own state.
Yeah, and then obviously it makes good financial sense that we've already mentioned our funding is limited, and we're always looking for ways here at ADAP in which we can partner with other groups to achieve our goals. My attendance at the State Head Injury Task Force, which is the advisory board that Maria referenced, this is one way that's critical for me to learn about what other groups are doing throughout the state, and also for me to share concerns that we've identified through our activities as the P&A in the course of our work. And it's really been through that group where I've been able to engage in a number of other activities that we'll talk about in a few minutes that have brought about these nice collaborative partnerships.
Yep. It's just better across the board for consumers and families. It's a nice check and balance. We get good quality assurance by working with our P&A. We can keep each other informed about what's going on with programs and monitoring and service delivery and training. And the more the P&A in your state can know about what you, the state program, are providing, and barriers that maybe you're experiencing or successes that you've had with other programs, the better they can guide other agencies towards including brain injury within their services and within the priorities in those agencies. So that just helps the individuals that you serve all the more. So how do we work together? We've hit on a few of these things. Christy, anything you want to mention here?
I'm looking. I think we've covered a good bit of this. I would just remind you about the development of the annual priorities and goals, just to make sure that you're communicating with one another about what you're seeing and what you feel like is most important. I know this year ADAP conducted a number of focus groups. I met with some TBI support groups to gather input about what they felt were the most critical issues, and really learned a lot. There were a lot of issues that were raised that were just not on my radar. So it just is another example of why it's so important to reach out to those specific groups.
Yep. And, on the service program side of the fence, it's important to include the work that the P&As are doing within your annual state plans. Have them take a look at that, provide some input for that, so that, we're all on the same page.
Okay, so I just want to quickly mention a few of our initiatives as we're kind of keeping an eye on our time here. Maria already mentioned that we're appointed as a member of that advisory board, and we've been appointed to a number of subcommittees. We've recently worked on return to play legislation. We passed our concussion legislation, I think it was in 2011, and ADAP served on that committee to provide input as part of that group and to help research legislation that was already in existence across the country. We've recently been working on return to learn efforts where, we know that we have the IDEA and Section 504 that have those protections in place for kids in the school setting, but we have kids who fall through the cracks who maybe their concussions are resolving, many of which resolve in a few weeks, and those the IDEA or 504 may not be the best fit to serve those particular kids' needs. So we're looking at other ways that we can support those kids, and Maria has brought in an expert and has been working with the State Department of Education in that way. One that I want to highlight that I would encourage you as our P&A folks, ADAP attends the NASHIA conference every year. I think we've been going for the last 3 or 4 years now and had the opportunity to present a couple of times. But it's been through that conference where we have really been able to meet TBI experts around the country, one of which was Dr. John Corrigan. While attending that conference, I learned about the OSU TBI identification method, which is a screener, not a diagnostic tool, that was developed to basically gather information about a person's history of exposure to neck and head injury. And the reason why that's critical is I'm now able to use that tool as I am out monitoring and investigating in our efforts, and then can better link individuals to rehab coordinators, to TBI coordinators in our state to make sure that those people are supported in the systems where they're being served, and then also to help support them as they're transitioning out. So I think we have this link later in the presentation, but it's brainline.org, and if you just search OSU TBI identification method, there's an online training that's free. Dr. Corrigan does that training along with a colleague that helped him develop that screener. And then the screener is there for you to download for free, and you can use it, as often as you'd like. So that's a really excellent resource that you might consider using in the work that you're already doing. And then finally, a fun kind of project that was easy, and it's just a really great example of how you don't really have to complicate things. ADAP works with the Alabama Head Injury Foundation, which is a group that was founded by professionals and families that provides information to help clients and families access available resources. We hosted what we called a Brain Freeze Challenge. So we are the P&A that sits on a university campus, and so we have access to students. And so to raise awareness, we set up a tent in a popular location around food, of course, on the college campus, and students were invited to participate in a number of brain teasers to kind of test their knowledge about TBI, and they registered for a raffle. We provided them with free Italian ice and asked them to take a selfie demonstrating their best brain freeze pose, kind of like the ice bucket challenge, really just to raise awareness. It was a fun event, but we know this is a demographic that is at high risk of engaging in behaviors that could result in concussion or brain injury. So it was just a fun way for us to provide information about the P&A, but then also to provide information about TBI in general, and then help this organization also get the word out there about who they are. Maria, you want to start here?
Sure. So, you've heard us mention training a couple more than once. It's very important, and it's something that, I always try to remember to do on our side. When we have core competencies training for our TBI staff or our VR staff, we include an invitation to the P&A staff to participate with us so that they can, be trained on whatever is the current issue that our own staff are getting trained on. And it's very important to, offer training and education to all of the P&A staff, to just go in and do an overview of what brain injury is and what the services are and what signs and symptoms of brain injury are for all of the P&A staff. So we have them come over to us. We go over to them and provide them with information on a regular basis. We certainly have invited them to state conferences and national conferences, and we like to present together. And again, the better informed both programs are, the more we can help guide each other and other programs towards, positive change and inclusion of brain injury in other programs.
Okay, so I think we can move to the next slide.
Oops.
So as we kind of wrap up, the last few slides in our presentation are some resources that are available to you that Maria will mention, but and I may let you talk a little bit more about the grant funding opportunities, but I mainly just want to consider P&As to consider the work that you're already doing and how you might incorporate new TBI initiatives into that existing work. You know, Maria mentioned as P&As, I definitely need the support of our TBI experts, and then they need the support of the P&A system to push systems forward to create change that, you know, through some of those mechanisms that are unique to the P&A system that they're not able to do. So, you know, you might think about, given our limited dollars, I know one year we decided to primarily look at, through the use of that TBI screening I mentioned earlier, during our monitoring visits that we were already out doing, we looked at the prevalence of TBI history among certain populations. So we really saturated our mental health facility. We also are in our psychiatric residential treatment facilities. There's 19 of those in our state that serve kids under the age of 21. And we did these random screenings to see what the prevalence was of history of TBI among those populations, and found that, particularly in our PRTS system, where there's a lot of peer-on-peer violence, that includes head and neck injury, the numbers were pretty significant. And so we're presently working with the licensing agency in that particular system, again, similar to the work that we're doing in the Department of Mental Health, where they need to be using a specific screener rather than just that psychosocial history and some of those more general assessments that are used in the intake process. There are screenings out there, not just this one, but others that are specific to TBI that can really help in the development of appropriate treatment and services for people who are living in those systems.
Yes. You know, in listening to Christy talk, I hope that you guys that are on the service program side of the fence get a good sense of why it's important to know what the P&As are doing with agencies in your state. You can learn so much about what's going on with another department than you may be able to find out on your own. And in fact, I mentioned with our last grant, we truly learned about how big an issue it was within our own juvenile justice system here through the Protection and Advocacy Program. And that is why we ended up selecting, in large part, that population to serve with the last ACL TBI grant that we received. It's very important to be aware of what kind of relationship the Protection and Advocacy Programs have with those agencies, so you know what you're walking into. When you may mention each other, you just need to communicate with the P&A so you know a little bit about what is going on, and it is important to introduce them to any new partners that you make with any new funding initiatives that you have. And then finally, you go ahead.
No, you go ahead.
Okay. And then finally, we included a few slides that have some information about other national organizations that may be of some use to you. The TBI model systems come through funding through NIDLR. You'll see that on here. The Brain Injury Association of America and the U.S. Brain Injury Alliances are a part of the greater network. Here are some areas that your TBI service program can either provide training for you on or find someone who can provide training. We all communicate with each other a lot, especially if we're involved with NASHIA, and we know who are experts in all of these fields related to brain injury. So if you need a particular resource on a particular topic, please reach out to us. And then finally, here are some online resources for you. I know Christy mentioned the OSU TBI ID. There's a link here as well as for Brainline. Get Schooled on Concussions we have used a lot with our Department of Education work here. We use the model systems fact sheets a good bit, and you know, Christy and I put this together, so I know she uses a lot of these same resources.
Yes, and they've been critical. You know, even the Think First, there was a PRTF where we found that they had no concussion identification prevention protocol policy at all, and it was through this group we brought them into that particular program to help them develop that protocol and those policies, and to reduce the number of peer-on-peer incidents that were occurring there. So I frequently use a number of these resources, and would encourage you as P&As, if you've not looked any of these resources, if you're not familiar with them, I would encourage you to check them out.
And then here's a link to our own programs, and there are some resources included on these sites as well. So thank you very much. Carrie, we'll turn it back over to you.
Wow, thank you, Maria and Christy. That was fabulous, and thank you, David and Becky. We do have a couple of questions that have come in for our presenters. The first one is for Christy. Tracy Barney wants to know, how does your agency partner with Adult Protective Services?
Partner with Adult Protective Services. Well, we have litigated. We at this point don't have a partnership. I'll be honest, we don't have a partnership with Adult Protective Services, and I don't know. Maybe you and I could talk offline so that I can understand maybe a little bit more about what your interest is with that particular group.
Fabulous. Okay, I think we've got another question. Terry Imus says or asks, who do we contact to update the state contact for TBI Arkansas? The person listed has not been in that position for at least 2 years. And Terry also says the Arkansas Trauma Rehabilitation Program is no longer sharing TBI responsibilities with the Spinal Cord Commission in Arkansas.
Well, this is Becky. I'll go ahead and answer that. Thank you so much. We try to keep that resource updated, but as you know, it can be challenging with staff turnover. So if you could send me an email at execdirector@nashia.org with the changes that need to be made, we'll make sure that they get done right away. Appreciate your help with that.
And we can help you locate who the contact person is there.
And can I add, this is Dave from NDRN. Anyone that needs contact with their local P&A, our website, ndrn.org, has information for every state, contact information and all that. So if you need that.
Great, thank you. Thank you to all our presenters. I think that was the last of the questions that we received. I want to thank everyone for viewing our webinar today, and please join us on September 14th and October 19th for a 2-part series in collaboration with the National Council on Aging. Also, you can still register for NASHIA's 29th Annual State of the States in Head Injury meeting, which will be held in Des Moines, Iowa in September. You can email us at training@nashia.org to join our contact list and to receive notice of future webinar offerings. To view our archived webinars and much more information, please visit the NASHIA website. And if you're interested in joining NASHIA, please contact Rebecca Wolfkiel, our Executive Director. Thank you again for viewing our webinar, and please remember to complete your evaluation for us when it pops up on your screen. And a big thank you to our presenters again.